is finished. This is an OFS project led by University College London and Sheffield University, as well as Universities UK, Office for Students, Student Minds and NHS England. So it's a 2-year project that was looking at how universities can build partnerships with their local NHS mental health services. Some of you might have already guessed, but there are very strong but mixed views about whether this is a good thing or not. And I'm really aware that this is something that we need to try to manage and be mindful of when we come to launch the toolkit. So today I'm going to talk a bit about the research that went into the toolkit, and I'll also give you a sneak preview about the toolkit and just give you an overview of some of the things that are going to be in the toolkit. But I'd really like to encourage your critical feedback on this, just because it really will help us to think about these messages that we need to be clear on and be careful about when we come to disseminate the toolkit later this year. So just to get down to it, in terms of some context for what this project was trying to do, these are some quotes that we've pulled from our own research, speaking to students and staff from universities that have already been trying to develop partnerships with their local NHS services. And when we talk to students or staff as to why they are trying to develop these partnerships, these are some of the things that they are trying to address, which I'm sure will resonate with some of you. So there's this idea of there being a lack of joined up working between services within universities as well as with local services. It could be charities, but we have a focus on NHS services. So this may mean that there are gaps for students when they're trying to transition between services. When we talk to staff within universities, working with students who might be in distress, they feel like they work quite defensively because there's a fear of getting it wrong. So sending the student to the wrong place or not knowing how to hold their boundaries. There seems to be a subset of students who fall between these gaps. So these are students who might be too critical for a university service, for instance, but not critical enough to meet the threshold to go into an NHS service. So they sort of get pushed around or fall in between the gaps. And then this idea of students having to repeat their stories or repeating assessments over and over again. It's hard enough for some students to reach out in the first place, but then if they're having a negative experience or if they've been sent to the wrong service, then this can definitely create a barrier for them reaching out again if that's what they have to do. And so in terms of this project, one of the ways in which we think these issues can be addressed is to have an effective response that includes unity between sectors, so higher education, NHS and third sector, as well as a commitment. So not just a one-sided commitment from universities or NHS, but a reciprocal commitment to develop these partnerships and have better alignment between the services and the policies that they are run by. And this idea of moving towards coordinated mental health care for students. So if any of you do research in other types of mental health research outside HE, coordinated care isn't a new thing. It just seems to be a new thing for students. So there are lots of really good models and examples from other countries and other sectors where we think we can really learn a lot from those models in higher education. And just to say that we're not the first people to be saying this, that it's in line with lots of recommendations from the University UK Step Change Framework, the Charter, even the NHS long-term plan. For the first time, they're showing a real commitment to young people and students. And all of these frameworks basically propose that we need this cross-sector working in order to address some of these gaps and ultimately enhance student mental health provision. So with this in mind, the specific aims of this particular project, because we can't tackle all of it, was to first of all just characterise the current state of partnerships between a group of universities that were committed to develop partnerships with their local NHS services. And later on, I'll talk a little bit more about the universities that we worked with. So once we've figured out what these partnerships look like, how many are in place and how to do that, we wanted to see if we can find sort of overarching factors. So while there might be local specific strategies, there are broader sort of outcomes that we can learn from this in terms of trying to disseminate this across the sector. So what are some of the underlying practical activities that universities can be doing to build and maintain these partnerships? Just wanted to highlight here, I already talked about some of the frameworks that I'm sure you're all familiar with, and this is the sort of view that we're having for the toolkit. Again, we're not trying to reinvent the wheel. We very much see this toolkit and this framework as complementing a lot of the frameworks that are already out there as part of a sort of mentally healthy universities family or movement. So we talk about these other frameworks in our toolkit as well, and we're working closely with Student Minds in UUK to try to make sure that it's not about universities picking and choosing one toolkit or one registration over another. It's about using a library of resources that they can use to ultimately improve student mental health provision. So a quick overview about what we did. We consulted students and staff, so from 8 universities across 5 cities. This included 36 student service users and non-users. So I won't talk much about this work because there was a dedicated student co-production project led by UCL that ran parallel to this work and fed into the toolkit. So we do talk about the findings in the toolkit, but I won't go into too much detail today. If you are interested though, give me an email. I can put you in touch with Kirsty. She's the researcher who led this at UCL. But we did focus groups with 36 service users. So this could be an NHS service or a university service, as well as what we called perception groups, so non-users. So how do they perceive services? We also consulted staff. So these were specifically professional staff, not academic staff. So they could be working in disability services, wellbeing services, counselling or equivalent services like mental health services. So we did a load of consultation. Then we also did research. So we've done a systematic review looking into the measures used to look at wellbeing and mental health in a university setting or with students. We did scoping exercises, so we looked at websites to see how universities are talking about their services, so how they're communicating with students, and we did dedicated focus groups and follow-up interviews with students and staff. So we analysed it just like that. We spent about a year collecting data and then a year analysing data. We pulled all of it together to try to identify some of these key themes coming from students and staff. There was a dedicated, we've called it risk analysis, but basically dedicated thematic analysis looking at the risk protocols in place between university and NHS services. So we put all that together. And from those findings, so from the research and the consultation and the various analyses we did, that's how we identified some core areas of the toolkit, which I'll show you in a little bit. And basically the toolkit comprises of what we've called domains. So this is language that you might be used to seeing in the charter or in the step change framework, because we're very conscious to try to use complementary language. So they have domains, which are priority areas. So we've also developed domains as part of the toolkit, which are backed up with case studies, quotes. We're doing some blogs and podcasts and things. So really try to disseminate it in different ways as possible. We had critiques. So we had a group of what we called critical friends throughout the development of conducting the research, the consultation and developing the toolkit. So this was a mixture of our student research team. We had our university partners as part of the NLC, which stands for a National Learning Collaborative, which is like a big group of universities and NHS service staff coming together to talk about these key issues. And we also had critical friends from what we've called sort of organisational partners like Student Minds, SMaRteN, things like that. And then share. So this is the stage that we're at now. The toolkit is ready and we plan to disseminate it towards the end of March, start of April this year. It's probably going to be a free online event rather than a face-to-face one to hopefully make it a bit more accessible. But certainly today, I'd really like to hear your views. If you've got other ideas as to how we can disseminate the toolkit, particularly we're interested in not just having an information sharing, this is what we did, this is what the toolkit is. We're really keen on offering something that helps the implementation. So that next stage, how can you actually practically embed some of these practices if that's something that universities would like to do to support this next stage, the implement stage, the 7. So all of that research, all of that work underpinned the toolkit, which is a 35-page document that will be available online. And so the toolkit includes case studies from the different university partners, providing examples of how they've set up a partnership or done a specific activity and what outcomes they had, with some recommendations from the good practice examples that were recommended from students and staff in the project. We've tried to embed student and staff voice throughout the toolkit. So when we've come up with a recommendation, it's not come from us as a research team, it's come from the evidence, it's come from the research, and it's come from the students and staff who we consulted with. So I'm going to have a go at now showing you the toolkit itself. Here it is. You probably can't see it. I'll just zoom in. Thanks, Amy, for the suggestion. So here's just an example of a toolkit. So just to emphasize what I just said, it's very much a practical toolkit here. So it's a little bit different to the charter and the step change framework in the sense that we've tried to hold off on cramming in research and the academic stuff. It's very much straight practical bullet points. These are some easy steps that you can do. Here's what you might be able to do and why. Here's links to others. So it's more about starting those first steps towards developing a partnership. But I will go back to the PowerPoint because I've zoomed in on some of these pages just to give you an example. So it's very much a practical toolkit, and this is designed more so for heads of services from a university point of view. So we're aware that one of the biggest limitations of this work is that it started right at the start of the pandemic and finished just as we started to think about going back to normal. So whilst the original plan was to involve staff in the NHS a lot more so than we did, so all of the work that I just described, the original plan was to mirror that data collection with staff working in NHS services. But unfortunately, and rightly so, at the time when we were collecting data, the priority for the NHS was very much surviving and preserving life at that point. So we don't have as much involvement from NHS staff that we'd hope for. They were included in terms of critical friends. They attended all of the National Learning Collaborative meetings. At Sheffield, we have a very good relationship with our local NHS staff. So we've tried to make most of the relationships we do have, but we are aware that that's one of the biggest letdowns of this toolkit, is it's very much university focused. And so I think moving forward, if there is any more work to come from this, it would be now starting to see how we can develop similar practices or learn a bit more from NHS staff and services too. So I said this earlier, but I just wanted to reiterate that this toolkit is very much, we're seeing it as part of a mentally healthy universities family or movement. So we've tried to embed recommendations from the step change framework, and with permission from Student Minds, we've linked to parts of their charter wherever is necessary. And so a lot of the start of the toolkit just frames where we see the toolkit sitting and how we hope it would be helpful. And it's ultimately a vision to sort of empower universities. So this isn't criticising universities or services about what they haven't been doing. This is just trying to provide practical starting points for what they could do if they're interested in setting up partnerships, and why we think there are some of the benefits of setting up partnerships. So you might still struggle to see this, but one of the things we've done in the toolkit is what we've called a project on the page. So I was just going to use this quickly to provide a summary of what we did, but some of it I've already covered. So I've done the issues part, I've done the aims part, and I've done what we did. The middle colourful part, these are the domains that I mentioned, and I'll go into a bit more detail in a minute, but essentially we identified 5 key domains. Each have case studies and practical resources to back up these domains and other research to go into them. But ultimately, we're saying that successful partnerships require universities to commit to a number of these key areas, such as co-producing with students and staff. So we work with Student Minds quite a bit on this one. And this is where our dedicated student co-production project is based. We also think it requires a commitment to collect and securely share data and absolutely have conversations with students and staff about how we might do so. Manage risk across pathways. I'm aware language like risk might jolt some of you, particularly if you came to the event Monday evening. I know that there can be sometimes some stigmatizing or labeling language that goes with risk, but this is very much used from more of a practical policy point of view. So this is when we talk about risk, we're talking about students at the very top end. So these are the students who will need likely multiple interventions from multiple sources with an actual dedicated what we call risk procedure in place. This is what just goes on in the background. These are the things that universities have to have in place to make sure that they are appropriately escalating or de-escalating risk. And it's risk in terms of both mental health, but also academic outcomes. So sorry if I've said risk too much, but I just wanted to clarify some of the language. That's just the language that has to be used when we're dealing with that really high clinical end, which is only a small proportion of students, but when you look across the whole student population, it's still a significant number of students. A key part around measuring and reporting outcomes, and then finally evaluating services and evaluating the impact of those partnerships. So these are the 5 domains. I'll give you an example of the co-production one. And as and when the toolkit is launched, the idea is that it's very interactive. So you'll be able to click on these domains and flip backwards and forwards. It's not meant to be a linear toolkit, because the idea is that each of these domains are connected. So it might just be that if a university is approaching this from the first point, it might be that they're focus is around evaluating services and partnerships, for instance. So they might choose to start at domain 5, but what they'll learn when they look through the activities in domain 5 is that it's inevitable you will need to include co-production with students and think about how you might want to share and collect data. So they're all interconnected. So here's just an example of one of the pages. This is domain 1. What it looks like. So we've got these navigational buttons at the top where you can flip through. Again, I don't expect you to be able to read this, but it won't be long until the toolkit is out. But here's just an example where we've got a case study, really straight to the point. So what was done, why they did it, links to the relevant websites to really try and showcase some of the work that the universities have done. Factors to consider. So despite the fact that these universities were very committed and they had dedicated funding to set up these partnerships, it certainly didn't mean that it was easy. And so we're trying to sort of share what they've learned, so that the barriers and the opportunities and how they've overcome that. So what they learned from trying to do this. So we've tried to boil down all of the key learnings about what to consider and potential impact that they had in order to set up those partnerships. So I talked a little bit about students. So some of the focus groups that our student team ran when they did the thematic analysis, looking at sort of priorities from students. Again, this is very simplified because I wanted to stay to time, but ultimately students, whilst there are obvious concerns around data sharing and data clarity and debunking some of the myths around data use, they did in principle seem to be quite supportive of the idea of setting up partnerships, however that may look like. They recognised that it wasn't one size fits all, and some students would just like go into the standard model of how services are like now. They just want one model to look at. They don't want to have to think about, oh, if I go here, I might be referred to here, here, and here. So it's very much, there was a concern that partnerships might overcomplicate the journey, but that certainly wasn't the aim in terms of universities setting up these partnerships. And students believe that it does have potential to streamline access. So rather than approaching different services at different points, if you just went to one, even if it was the wrong one, they could have direct referral into other services rather than having to repeat those assessments or speak to other members of staff. It could be that you can just have direct access, reduce waiting times, share best practice. This is something that came out in the staff work as well. So there seems to be a real benefit from staff from different sectors coming together and coming to decisions together and learning about, okay, how might we handle this particular case? Where is the best place for the student to go? Even if they go to you, at some point they will come back into the care of the university. So how can we manage our relationship to make sure that the student has a sort of swift transition between those services? It could improve links between those services, like with the example that I just said, and improve communication about student support. So that's both to the students themselves and communication between staff. But ultimately and understandably, we found that students want ownership over the mental health support. So they want to be, and they should be, involved in these key decision processes, especially when we're dealing with data sharing and consent procedures, to make sure that they can very much opt into where their data is going and how their data is being used. So just a couple of staff views about developing partnerships. So a lot of them talked about this future vision, which we talk a little bit about in the toolkit, but it's more so we're writing up papers for like academic journals. We talk more about this future vision in there. But one of the things that I found quite interesting is that despite the fact universities have been developing these partnerships for a few years, they're still very much at the very early stages of this. But what was really nice, what I found was nice, is that they had this long-term vision. And in my experience of some other work that I've done is that universities are often forced to have a bit of a knee-jerk reaction to making these decisions about how to respond to it. But it was very much the opposite case here. They had this long 5-10 year vision, and they were describing what they were doing now to build the stepping stones to move towards this future vision. And so some of the reasons they were doing this is because they hoped that by developing partnerships, that it has potential to help staff have access to necessary data. So this isn't all data to everyone. This is data that is preventing like clinical staff from making decisions quicker, which is delaying students to have access to support. And likewise, if students are discharged from an NHS service, universities don't know, students don't know. So again, it's making sure that there's appropriate access to appropriate data to inform these decisions. A lot of universities were struggling to report outcomes on all students. This came up a bit on Monday as well, that what do we do about students that don't engage? If we're only recording information on the students who A, come through the door, and B, have a successful outcome, i.e. they made it to the end of the service and then filled out the feedback, we're only shaping services based on the best outcomes. Whereas if we've got better data strategies in place and collecting more consistent data, then we can learn what happens to students when they do leave a service or leave a university or decide to take a break in their studies. Might save time and resource. There were lots of talk about duplicated care, not only within universities. You might have a student being seen by multiple services and those services don't know, but also duplicating care that is perhaps the responsibility of the NHS, but the universities having to hold on to them because of the NHS waiting time. So there's a lot of duplicated time and resources being used. And then this last one, I just wanted to bring your attention to in terms of clarifying staff roles. I liked this one particularly because it's been reported before. So Gareth Hughes from Student Minds, he did a really good report quite a few years back now, looking at the role of academics and how they felt their role was in terms of supporting students and their mental health. Some of the key findings there was that academics, so personal tutors, they perhaps aren't clear on what their roles are. They find it difficult to hold their boundaries. They perhaps don't feel like they have support from their university or the guidance to know what to do when. And that was very much mirrored in our research when we were talking to staff at the professional end as well. So that's a lot of work to do and a long way to go. So some bite-sized information in terms of if anyone on this call today is interested. An easy place to start, which all of the universities did, was to map existing services and pathways to identify those gaps, because services are different. They're very much catered to the local provision, so they might not be fully aware of those gaps. And this is helpful to map the journey both for students, so what does their journey look like through services, but also map data flows. So which staff have access to which data and how can that be streamlined, or is there some sort of actual restrictions that do need to be put in place to make sure that data isn't shared? So it didn't seem like universities were clear on how the data was being handled. Identify primary contacts from local services. This all comes down to relationships. Partnerships are made on relationships from staff. So a good place to start is to make those local contacts, but also have the protected time and have platforms in place to enable staff to come together from different services and share experiences and have these conversations. And importantly, involve students and staff early on, as well as senior staff. So you really need buy-in at the senior level here. Involve them early in the work so it shapes and it's relevant to them rather than doing research to them. So just to finish, there is a potential model that could be achieved here where the two sort of feed into each other. So there is a potential that by developing these partnerships between services, it does have the potential to address some of the issues that we found in our research. So developing these partnerships and procedures and policies could clarify staff roles, could reduce service duplication and time, as well as staff time. It could improve data standards. Even if you don't go down the partnership route, just by mapping what you're currently doing with your data can help you almost do like a bit of an audit, can really help you think critically about, do client contracts and consent procedures need updating because perhaps they're not practical or they're not feasible. And it does have potential to maybe fill some of these gaps that students are falling through and ultimately be responsive to diverse student needs. So not just the best case scenario of those who are making it through the door. So I just wanted to end by acknowledging all of our university partners and organisations that took part, as well as the research team at the University of Sheffield and London, and just say that if you're interested to find out more, you can email me. And if you want to, if you've got any advice on how to disseminate this toolkit, do please get in touch. So I'll just stop sharing.
Brilliant. Thank you so much, Emma. As always, a fantastic presentation. Certainly the staff and student views on some of the challenges around building these partnerships kind of really echo with some of my experiences and observations. So I'm really looking forward to kind of engaging with the toolkit more and having more of a deep dive into it. We'll open up for discussion.